Dear students, welcome back. In this session, now we are going to discuss about the regions of the abdomen. The purpose of knowing these regions of abdomen is for easy study or describing the location of the viscera. For this purpose, the abdomen is divided into regions and it is divided into 9 regions. Okay, so how these 9 regions are divided means by 4 imaginary planes. So the regions of the abdomen is divided into 9 regions by 4 imaginary planes. 2 vertical planes, that is 2 lateral planes, and 2 transverse planes or horizontal planes. The horizontal planes are Trans-pyloric plane and the Trans-tubercular plane, whereas the lateral planes are right lateral plane and left lateral plane. Okay, these lateral planes are the vertical planes and Trans-pyloric and Trans-tubercular are the horizontal planes. Okay, now we will see each one of the plane. First we will consider the horizontal planes. In that, the first one is the Trans-pyloric plane. This Trans-pyloric plane is called as Trans-pyloric plane of addition. Okay, this plane passes midway between suprasternal notch as well as the pubic symphysis. Okay, so this Trans-pyloric plane passes midway between the suprasternal notch and then the pubic symphysis. Okay, and this Trans-pyloric plane it lies roughly a hand's breadth below the xiphisternal joint. So when you keep your hand at this part, okay, so it is almost your breadth of your hand below the xiphisternal joint. From the xiphisternal joint to the Trans-pyloric plane, you will have hand's breadth of space. Okay, now anteriorly this plane passes at the tips of the 9th costal cartilages. At the tips of the 9th costal cartilages. So this is the tips of 9th costal cartilages at the anterior aspect. So if you see this plane on the posterior aspect, it is present below the lower border of the L1 vertebrae. So this line, this plane is present below the lower border of the L1 vertebrae. Okay, normally this plane, above this region, above this plane, normally the organs present in this plane are pylorus of stomach and also beginning of the duodenum, neck of the pancreas and hyla of the kidneys. So these are the organs we can find above this Trans-pyloric plane. Okay, now another transverse plane, that is Trans-tubercular plane. So this is the Trans-tubercular plane. This Trans-tubercular plane passes through the tubercles of the iliac crest. So this one is the tubercle, this one is iliac crest and this one is the tubercles. So the tubercles of the iliac crest and the body of vertebrae L5 near its upper border. So on the posterior aspect, you can find this plane is passing above the upper border of the L5 vertebrae. Whereas in the trans-pyloric plane, lower border of the L1 vertebrae. But this trans-tubercular plane is passing through the tubercles of the iliac crest and also the upper border of the body of the L5 vertebrae. Okay. Now, so this is about the trans-tubercular plane. Now come to the right and left lateral planes. So normally these two planes correspond to the mid-clavicular line. It corresponds to the mid-clavicle. For example, clavicle is present here. So mid-clavicular lines or mammary lines. Each of these vertical planes pass through the mid-inguinal point. Here you can find, normally we are having here this inguinal ligament, and you people also know the mid-inguinal point here. So these lines corresponding to the mid-clavicular line, each of these vertical plane passes through the mid-inguinal point, and it also crosses the tip of the 9th costal cartilage. So this plane also passes the tip of the 9th costal cartilage. So here you can find here. So these are the two lateral planes on both the sides. It cuts at the mid-inguinal point. Okay. And also it crosses the tips of the 9th costal cartilage. So now these two transverse planes are divided by this left and right lateral planes, causing 9 regions, okay, or forming 9 regions. These 9 regions are left side 3 regions, okay, right side 3 regions, at the middle 3 regions. Okay, so totally 9 regions are formed. Okay, so finally the regions of the abdomen is having 3 vertical zones. One is the median vertical zone and right vertical zone and the left vertical zones. Okay, from above downwards, the names given to these regions are, if you see the median vertical zone, so the medial vertical zone, the uppermost region is called as epigastric region. Okay, here epi means above. Above the stomach or belly, we can call it as epigastric region. Okay, and the next one is the umbilical region. So where the in this region the umbilicus is present. So the region surrounds this umbilicus is called as umbilical region, and below this umbilical region you'll have the hypogastric region. So that means below the stomach or belly, this region is called as hypogastric region. So what are the 3 regions present in the median vertical zone? Epigastric region, umbilical region, hypogastric region, from above downwards. From above downwards. Now coming to the right side, so the uppermost region is called as right hypochondriac region. So here hypo means below. Hypo means below. Chondriac means costal cartilages. Cartilages of the ribs. Okay, costal cartilages of the rib. So the area which is below the ribs, cartilages of the ribs, which is present on right side, so it is called as right hypochondriac region. Okay, and the same way on the left side also, so it is left hypochondriac region. And then Next region is the lumbar region. On either side of the lumbar vertebrae, so you'll find two regions, right side and left side, right lumbar region and left lumbar region. Okay, and below this lumbar region, so the region which is nearer to this iliacus, okay, iliac region, so it is called as right iliac region and left iliac region. Okay, so if you can see this bone, isn't it, hip bone, so you'll find this iliac crest, okay, and which is nearer to this region, so it is called as iliac region. Okay, in the hip bone we'll have many regions, ilium, ischium and pubis, but this region is nearer to the ilium, so it is called as right iliac region and left iliac region. So totally 9 regions are present in the abdomen, which is formed by 2 horizontal planes and 2 vertical planes. The 2 horizontal planes are trans-pyloric plane and trans-tubercular plane, and the vertical planes are right lateral plane and left lateral planes. Normally these vertical planes are continuous with the mid-axillary line, and it end up at the lower end by cutting the mid-inguinal point. Okay, so now, so why should we know these regions of the abdomen? So for the location of viscera and also describing the where the exact position of the viscera are present. Okay, yes. Now we will see in each regions what are the organs present, what are the visceral organs present in this. Yes, if you see this median vertical zone, that is epigastric region, umbilical region and hypogastric region. So if you see the epigastric region, normally it consists of stomach, liver, pancreas, duodenum, spleen, adrenal glands. So this duodenum is almost the first part of the duodenum. So mainly we can consider here is the main organs in the epigastric region are stomach, duodenum and pancreas. So these 3 organs occupy major part in the epigastric region. Although so many parts are related, but the major parts related to this epigastric region are stomach, duodenum, pancreas. Okay, now if you see on the right hypochondriac, so the main organs related to this region or main organs occupying this area is liver and gallbladder, or also some organs are also related like right kidney, small intestine, like this. Okay, if you see on the left hypochondrium, so mainly it occupies spleen and left colic flexure. Okay, that is colon. Okay, and also left kidney and pancreas are also related to this region. Okay, now coming to the umbilical region. So this umbilicus is mainly at this region, mainly this area occupies by the coils of small intestine. So parts of the small intestine, and also at this region aorta and inferior vena cava is also related in this umbilical region. Okay, now coming to the right lumbar. So in the right lumbar, it mainly relates to the right kidney, ureter and ascending colon. Okay, so in this area Mainly it occupies the right kidney, ureter and ascending colon. Okay. On the left lumbar, left kidney, ureter and descending colon. So right side, what are the things? A right kidney, ureter and ascending colon. On the left lumbar, left kidney, ureter and the descending colon. Okay, if you see the right iliac, okay, right iliac fossa, we can call it as right iliac region or right iliac fossa. So normally this area occupies cecum vermiform appendix. Okay, on the left side it occupies sigmoid colon, and also we can see some part of descending colon, but major part on the left iliac is the sigmoid colon. Okay, and the last one is the hypogastric region. So this hypogastric region, mainly the organs which are related to this hypogastric region are urinary bladder, coils of small intestine and enlarged uterus, that is female reproductive organs are related to this hypogastric region. So it is very easy that we can, if you want to palpate any of the organs, so this is the regions which are very much useful to palpate the organs. If you know these regions and what are the visceral organs related to these regions. Okay, and normally the abdomen is also divided into not only 9 regions, it also divided into quadrants. Okay, that is called abdominal quadrants. So here it is an imaginary, these quadrants are formed by one vertical plane and one transverse plane, and these are the imaginary lines which passed in between the umbilicus, that is along the median plane, that is the vertical plane, and another imaginary line which is drawn transversely at the level of the umbilicus, that is called trans-umbilical plane, which divides this abdomen into 4 quadrants. One is 2 are upper quadrants, 1, 2 are upper quadrants, and 3, 4 are the lower quadrants. And this upper quadrants is having a right upper quadrant, left upper quadrant, and a right lower quadrant and left lower quadrants. So these quadrants has given these names based upon its anatomical position only. Okay, so based upon this, so what are the visceral organs which are related or which are located in the right upper quadrant and left upper quadrant and right lower quadrant and left lower quadrant. So here a group of organs related to this right upper quadrant and left upper quadrant. Okay, like that. So in the regions we can specifically palpate in this region the organ may be this, like that we can find out in the regions. So this is very quick palpation can be done by knowing this quadrants of the abdomen. Okay, so this is very important to describe the location of viscera. Okay, so the regions of the abdomen or quadrants of the abdomen is done mainly for the purpose of describing the location of the viscera. Okay, In the next session, we will see the peritoneum. Thank you.